Hi, everybody. I'm Aliza Sherman. I'm the CEO of Ellementa, and I'm going to tell you a little bit about Ellementa. For those of you who have attended our webinars, you already know what this format is like. It's conversational. We bring experts to you, right to your living room, right to your office. Some of you are still working. I'm in Alaska, so people are still working here, just getting off of work at this moment, actually. So the way we work it is we have a quick conversation. Hi, Dr. Angie.
Hi.
And just wanted you to see us, know that we are here, that we're real, but then we're going to bring some slides on. So this will be like a webinar with some slides. We try to go really quickly through some basics for you because everybody comes to these webinars at different levels of understanding in terms of the endocannabinoid system, cannabinoids and terpenes. Sound familiar? Doesn't sound familiar? We're going to go over those things. I just wanted to say it's really cool to have Dr. Angie here because I don't know if she knows this, but she was an inspiration for a section of a little part of my new book. When I was looking for an expert on pets and cannabis, or pets and CBD, I found her website and I thought, oh, someday we're going to have her as an expert on our webinar. So it's really great to have you. I'm going to now do a little bit of magic. Let's see, Erica, what was I supposed to do? Some housekeeping? You always have to remind me these things.
Nope, I think I handled it. Go for it.
Okay, super. And we've got somebody from Ojai, Jersey. Type in your location. Oh, I see Pam from Long Beach. Hey, and Ishka as well. I hope I'm pronouncing it right. That is right, isn't it? Also from Long Beach. Good to see you all. All right. I'm switching over now. I have to press a couple of little magic buttons. We're going to go into the slide portion of this. Oh, I do have to say the instructions are, we're going to shut off our videos so that you won't be looking at us and we won't have to be doing those little expressions of, oh, yeah. So we're going to shut off our video just temporarily. Dr. Angie, do you know how to do? If not, Erica, I think can handle it.
Yeah, I can stop my video. Yep.
Perfect. There we go. Hey, all right, now for the magic of slides. Let's bring those up right now. And like I said, I'm going to just do some introductory things and a little bit of background, a little bit of information that helps set the stage so you will understand all of the things we're talking about afterwards when Dr. Angie takes over. So CBD and your pets, great topic. Our goal always is to empower you with better information about cannabis and CBD for health and wellness. We also want to introduce you to the Ellementa Women's Wellness community. But this is the most important thing to remember. Your wellness journey includes everybody around you. It includes your whole family, not just because you may be a caregiver, but also because if you're not well, you cannot take care of anyone. You cannot be well within your family unit. And as we all know, our pets are part of the family too. So that's something really important to consider. If we're in a bad mood, our pets feel it. If we're stressed, they get stressed. So it's important for us to make sure we are taking care of ourselves because we need to take care of our family and our pets as well. What is Ellementa all about? It's about education and empowerment. We want to bring experts to you. We want to be able to recommend quality products to you. We always test or try any of the products that we are talking about. We want to make sure that we know how it makes us feel. Now remember, everything is individual, and that's the same thing with pets. Each one of us has an individual way of reacting to cannabis and CBD, and those are some of the things we talk about at our events. So we have these in-person gatherings in over 60 cities across North America, women gathering together to talk about cannabis, to talk about CBD, all focused on health and wellness. So that's one of the things that we do. And these webinars are another one. So it's time for me to ask you a quick poll. You can actually interact with the poll. What pet health condition do you want to address with CBD? Now, we just gave you a couple of choices, and Erica makes this magically appear on the screen. Da, 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 da. There it is. Just picked a couple of general things that I've heard pet owners say that they're interested in helping their pets with. So there's anxiety and stress, skin conditions, cancer, digestive issues, or something else? Is there anything on this list? Just pick one. You can click on it. We can't click on it, but if I were to, the most immediate thing that we're facing right now is our Jack Russell is breaking out in this absolute burning red hot spot. It's not even a hot spot, it's a hot region all across her belly. And it seems to be flaring up anytime I give her any sort of regular dog treat. And it doesn't happen when I give her CBD treats. And I'm thinking that CBD treat is actually helping heal it up as well. So it's kind of an interesting thing. I'm personally facing that myself with our dog. And what is the result? Anxiety and stress. Yeah, a lot of dogs can be very anxious. I've got a Chihuahua, and I don't think she's as anxious as she is just being really tough. So she always seems like she's agitated because she's just ready to beat up the big dogs. All right, thank you so much for that. Really appreciate you participating in our poll. I'm going to let Dr. Angie tell you a little bit more about herself. We've got some things up on the screen, but Dr. Angie, give us, in a nutshell, a little bit of your background.
Yes. Well, thank you so much for having me. And I just have to say that the good news is that CBD works swimmingly well for anxiety. So good news from that poll. I think that we're going to be able to help a lot of dogs and cats. I am a practicing veterinarian in Boulder, Colorado. I have a house call practice, and I use integrative medicine for my patients. And what that means is I use traditional therapies and traditional diagnostics, but I also use alternative therapies like acupuncture and herbs. I use a lot of cannabis, and I use a lot of nutrition. I also use physical medicine, and really anything that helps bring my patients into balance. So I kind of have a view that's somewhere between completely natural to completely pharmaceutical. I walk the line right in the middle. In I think it was 2014, or maybe it was even earlier than that. Around 2014, my patients and my clients started talking about cannabis as we legalized weed in Colorado. And what's been really great is there's been a lot of open conversation, and I've been able to use a lot of cannabis in my patients with a lot of great results. So I'm excited to share with you today everything that I know and help you apply it to your own animal.
That's amazing. It's really, really important for us to have experts who are actually practicing. So we've had many medical doctors on our webinars to date, and they are treating patients, human patients. So it's fantastic to have someone who's really treating dogs and cats with the cannabis plant. Now, I'm going to give everyone some background. I'm going to run through these pretty quickly, but here are some important things for you to know about so that the rest of this webinar makes sense if you're not familiar with some of these terms. So first, we're going to talk about the endocannabinoid system, or ECS. Normally, I talk about how humans have the endocannabinoid system. It's a system that lays over all other systems, including our digestive system, reproductive system, our nervous system, endocrine system. All of these systems have these receptors, and these receptors make up our ECS. Now, there's two receptors that are most well known. There are actually multiple receptors that are part of the ECS, but the two best researched ones to date are called CB1 and CB2. And CB1 runs throughout our whole body, but CB2 is concentrated a lot in our immune system. So cannabis interacts with our endocannabinoid system, bringing it to sort of a balance or a homeostasis. And by doing so, it is helping to moderate or modulate the other systems in our body and help bring those to balance as well. So when our ECS is out of whack, then that's when we're seeing a lot of disease. So this is now fairly new. The research on the endocannabinoid system started coming out in 1989 and 1990, which is why many people haven't heard of it, and why also many doctors are not learning about it right now in medical school. But more and more, we're finding out about it, and mammals have endocannabinoid systems. So animals also have and ECS, which is why cannabis can work on dogs and cats, but only certain parts of cannabis. So we're going to talk about that. You can use all of it, but I know Dr. Angie said right before we began that she's not really using THC. So we'll talk more about that in a moment. In the cannabis plant, there are some chemical compounds, cannabinoids, terpenes, and even flavonoids. So cannabinoids are phytocannabinoids, really is what's in the plant. And they are chemical compounds that will interact and either bind to those receptors that I just talked about, or affect them in some way, or affect each other. So THC is the most commonly known cannabinoid. That's what gets you that feeling, that altered state, feeling high. CBD is the one we're going to talk about today, but there's also CBN, CBG, THCA, THCV. So we have other webinars where we break this down even further. But cannabinoids are important and very prevalent components, chemical compounds within cannabis. And so are terpenes. The thing about terpenes, we like to say it's similar to the aromatherapy of cannabis. If you think about it, the terpenes are responsible for smell and for taste. So the terpene linalool, for example, we know it, we're all familiar with it because it is also in lavender. Well, that's in cannabis. There is a limonene, another terpene that is in citrus fruit, also in cannabis. So if you start to really break it down, this cannabis plant is almost like a superfood or a super plant. It's got many cannabinoids and many terpenes. The last thing I want to mention right now is something that's called the entourage effect, or a lot of scientists are now calling it the ensemble effect. It's the idea that the cannabinoids and terpenes work together and affect us, or work against each other and then affect how the other ones are working with us, with our bodies and our brains. So a really good example of this is if you get way too high on THC, if you're not feeling good, it's uncomfortable, and maybe you're paranoid, you can bring that high down pretty rapidly by taking CBD. And you'd have to take it in sort of a rapid absorption form, such as sublingually under your tongue. But if you put some drops of a high concentrated CBD oil under your tongue, it'll bring that high down. Why? Because CBD sort of blocks how THC binds to the CB1 receptor. All right, there's a lot of alphabet soup here. I don't want to get any further into the weeds here because we could talk about this forever. What we really want to get down to is how cannabis and CBD in particular affects our pets and how we can use it to help our pets feel better. I'm going to get to the next slide, turn it over to Dr. Angie. You're at the helm now. You tell me when to turn those slides and I will do so, but I may have a question here and there. So, and then don't forget everybody, we will give you a chance to ask your questions. You can also type them in right now into the Q&A button or into the chat box, and we will go in afterwards at question and answer time and get to those questions that you may have about your pet. Dr. Angie, take it away.
Okay, thank you so much. So I just want to start out by saying, when I found out about the endocannabinoid system, my mind was completely blown, and I checked in with my community of veterinarians and I was like, hey, you guys, like, did we learn about the endocannabinoid system? And I just totally forgot. Like, did I not show up to class? And I even took a poll of students, of veterinary students that had just graduated, and still no one's learning about it. And so it can kind of be overwhelming because we know about our digestive system and our nervous system. And even if you're not in medical school, we all learn the systems. And so the idea that we have this system that no one's talked about is super blowing. And I think the most important thing when we think about our pets is understanding the difference between THC and CBD. And there are a ton of buzzwords in the industry. And it's important to know that your veterinarian might feel really uncomfortable talking about cannabis for these reasons, because I don't think every veterinarian necessarily understands the difference. So when we just simplify it to THC and CBD, THC is still federally illegal, and it's legal in some states like Colorado and many others now. And that's the part that causes the high. This is the part that your veterinarian is concerned about, because dogs have more THC receptors than humans. So maybe you could take half of a gummy, maybe get a few milligrams of THC and feel comfortably high. But your dog could eat that gummy, and unfortunately they tend to eat other edibles that have chocolate and have other side effects, but they're really high, and they're so high that they cannot walk. They have a big concentration of these THC receptors right in the part of the brain that helps them balance. And so dogs get really sick. Veterinarians see this, and then they're immediately scared of the cannabis plant. You don't need THC to treat pets. I think there will be applications in the future as it becomes federally legal. I have high hopes for that we might be able to isolate THC and use it for pain and, cancer and other ailments. But right now, I don't use THC for my patients. One, because it's federally illegal, and I do hold a DEA license, so I definitely follow those rules. But also because THC can make you feel bad. I know for me, I live in a state where, everyone has THC. We have so many preparations available, and I have yet to find a preparation of THC that doesn't make me feel anxious and bad. Even just a milligram or half of a milligram makes me feel anxious. And I worry about our pets not being able to say like, hey, I am feeling really paranoid right now, or I'm hallucinating, or I'm really worried. And so I don't use it for that reason, because I have other things. CBD is the part of the plant. It's the cannabinoid that gets all the press. But really, it's only one. And we might find that other cannabinoids like CBN or CBG are just as therapeutic, but there's a lot of research out there just with CBD for people. But it is now federally legal, which is extremely exciting, as the Farm Bill passed in December. It does not cause a high, although in some people, it does make them feel there's enough THC in these really high CBD hemp extracts that they can feel kind of funny. And I have noticed that in some dogs. It's extremely rare, but it can increase appetite, decrease inflammation, and it just makes dogs and cats feel better. I've been using herbs for 12 years, and this is by far the most potent and diverse herb I have ever used. So I am ready for the next slide.
Oh, right. There we go.
Yes. And so one last thing, I just had an afterthought. So when someone tells you that they're treating their pet with cannabis, it's important to know that they're not differentiating between marijuana and hemp. So if someone's using hemp, they're using a preparation that's really high in CBD and very, very low in THC. And if someone's using marijuana, it's very, very high in THC. In fact, we're getting really good at breeding these plants to be higher and higher and higher in THC. And that's a little bit of the conflict in the veterinary industry, is that we see that marijuana is becoming increasingly more toxic, and we just need to start differentiating the difference between the marijuana and the hemp. So hemp-derived CBD is just, it's very readily available, and it is very safe. Now, you can use CBD to treat so many things, and I have to admit, the longer I use it, the longer this list gets. So maybe I have a dog that has anxiety, and so we start using CBD or like a hemp-derived CBD product, and we notice like, oh wow, like he's not itching as much. Or I use it in a cat that is maybe anxious or painful, and their chronic infection in their eyes went away. And so I think there's a lot of things that we don't even know yet. And so when people write me and say, hey, should I use CBD for this? I'm like, yeah, try it, because there's rarely any contraindications to using it. But Anxiety by far is the most reliable, in my opinion. I feel like anecdotally, if I'm using CBD for a dog or a cat, I have a 90% success rate. I'm pretty sure that's going to work, and that's really, really good. I've seen a lot of success with seizures. It's not going to be for every case. I use it a lot in arthritis, especially in older kitties. I mean, I think that's a really great application in an animal that doesn't have a lot of options. I have to say with arthritis, you have to use it a little bit longer to see the effect. Usually with anxiety, you're going to notice it like in the next day or two. It's going to be really quick. I have a lot of dogs and cats that are aggressive, and we've been able to take the edge off. I do use it a lot for cancer, and then even cancer prevention. I'm recommending that a lot of my patients use it as a cancer preventative. And I'm going to go through the exact doses I use for that later in this presentation. Chronic infection, chronic inflammation, really any disease in the body, I find it can be helpful. Pancreatitis, inflammatory bowel disease. So the list goes on, and probably if we were to meet back in a year, I'd have maybe 10 more things to put on here. So I am ready. Yeah, go ahead.
I have a question. So we used to be told to use rescue remedy for things like separation anxiety or right before a flight if your dog is going to be traveling on a plane. Rescue remedy being a Bach floral remedy. Mm-hmm. Is CBD something that could be used instead of rescue remedy or along with rescue remedy? That's another kind of question.
You could definitely use it along with rescue remedy. I think you're going to see CBD be a lot more effective than rescue remedy. And so it's one of those things that if your dog or cat has situational anxiety, you can certainly use it just in those terms. It doesn't have to be every day. Although as we study more of the pharmacokinetics, so basically the levels in the blood, there is some evidence that supports that, okay, if you know you're getting on a flight, dosing your dog or cat for 2 weeks ahead of time might help it reach a steadier state. And that being said, I have a lot of patients in my practice that just take CBD for certain events.
Okay, interesting. All right, here's your next slide.
Okay. So this is the trick, selecting a CBD product. So I'm going to talk about full spectrum extracts, and then we're going to talk about just isolates. And I want you to be aware of the difference because there's a very big price difference, and the market is being flooded with products. And so for you as a pet parent, this can be really confusing about what product you trust, what product might be effective, and then how to dose it. So when we talk about a full spectrum extract, basically they're taking the hemp plant and they're taking out a lot of the therapeutic compounds. They're not just taking out CBD. Just like we talked about earlier, terpenes and other cannabinoids like CBN, CBG, those are really effective. And we think that they might even be more effective when we put them together. So while it is more expensive, it's more therapeutic as you get this entourage effect. And so I definitely recommend full spectrum. And then there's a little bit of a difference between full spectrum and broad spectrum. And I don't think that is important for most animals. So if you see either one of those, in my opinion, it's probably fine. But for the broad spectrum, they have removed the THC. So what happens with the full spectrum is they just have to prove that the THC is less than 0.3%. So it's very, very little. While broad spectrum, like the THC, is completely removed. Now you're going to pay a little bit extra. And I have had a few patients where I think that probably could have mattered to them, like they were a little bit more sensitive, even to micro doses of THC. But for the most part, I think either one is fine. You're just going to pay a little bit more to have that THC removed. And I am ready for the next slide.
All right, there you go.
So you might see some isolates. And what that is basically where we just take out the CBD. You can get it from hemp plant, cannabis, or citrus. And there's probably even more that I don't know about, but these are the sources I've seen. it is less expensive. And I have used it for patients that I thought might be allergic to the cannabis plant. So that's very rare. It seems to be less effective, although there are no studies side by side looking at the difference between an isolate and a full or broad spectrum. All of the studies done in dogs to date, which there's 2 out of CSU and 1 out of Cornell, they have all been with full spectrum, full spectrum. And so when we look at those studies, we're not just looking at how CBD affects dogs with seizures or dogs with body pain. The other thing about CBD isolate is that you can get a little bit more precise in your dosing. So currently we need more research. We do have some out there, but it would be interesting to prove that that full spectrum or broad spectrum is superior to an isolate.
Interesting. Here we go. I jumped to the next slide for you.
Yeah, thank you. You got it. You got it.
Okay.
Yeah. So how it's grown matters. And as the market expands for this, for cannabis and CBD, it's important that we know where it's grown and that we trust the company. There are a lot of companies getting hemp from overseas. And in my opinion, once that happens, there's just less regulation about where it comes from. So my preference is organically grown. I eat organic for myself. And if I can get that for my patients, I think that's even better, especially when we're talking about extracting from a plant and you have a 10-pound kitty. I don't want there to be even a trace of any pesticide. And now that the Farm Bill passed in 2018, we're going to see a lot more states growing it, which is good for us because it is going to reduce the price. But it will be interesting to see, as long as the consumers keep pushing that we want this organically grown, I want to, it'll be interesting to see if the growers honor that. Okay, I'm ready for the next slide. So we're going to make sure whatever product we're looking at, that it's grown organically.
And so I was just going to throw one little thing in, that the hemp plant is known as a phytoextractor. It is like a vacuum cleaner that pulls toxins from the soil. So it's, as you said, it's so important to be organically grown, but that is a characteristic of the hemp plant. In fact, in Chernobyl, they planted hemp plants to pull radiation and toxins out of the soil. It's that powerful. And that is one of the other reasons why organically grown can be extremely important, because that plant is pulling from the soil. Here we go, extraction methods and concentration.
Yes. Okay, so this is a little bit controversial. So extraction method is just how are we getting the CBD and all the other good alphabet soup of, the THC, the CBN, the CBG, all that good stuff out of the plant. And here in Colorado, there's a lot of differing opinions about what's better. So I used to only prefer CO2, and I would only use products that were CO2 extracted because it wasn't using alcohol. But as the industry has grown, there's a lot of people using ethanol or other alcohol extractions. And because we can test the finished product, we can see that those alcohols aren't left behind, because if they were, that would be toxic and we wouldn't want any toxic residue. And so there's just kind of like this conversation back and forth of like, well, CO2 is cleaner, but maybe ethanol and other alcohol extracts actually get more of the good stuff. And so now that I've heard more science and I've seen a lot of good products that are actually alcohol extracted, I've changed my tune, but I do want to see that they're testing every batch afterwards. We know the CO2 is going to be clean, but maybe there would be something superior about these alcohol extracts. So I think that's something that over time, and as we get more science behind our extraction techniques, that we'll see. I notice a lot of products that are marketed towards pets that they are just not concentrated enough. So if you are going to buy something, just make sure it's at least 15 mgs or milligrams of CBD per mil. the lesser concentration prohibits adequate dosing. So that means, let's say you have a cat and you want to get this cat like 5 milligrams. Well, if you had 5 milligrams in each mill, you would be giving your cat an entire mill of oil. And most cats are just not going to be down with that. And so you're going to go through the bottle. It's going to be messy. And so for pets especially, and I use a lot of products that are even more concentrated than that, just because, cats don't want to have a ton of oil on their food. And it's kind of smelly oil too. It smells quite herby. And so I wouldn't spend any money on anything less potent than that.
Interesting.
So the certificate of analysis, this may seem a little intimidating, but really every CBD company should have it. The product I use, I have it posted on my website for every product. And basically they're testing for THC, CBD, all of those things, the terpenes, a lot of those components. So I like to see that they're looking at that and they can tell you how much is there, but they're also looking for contaminants. And contaminants are either pesticides. So going back to that organically grown, like we're kind of checking up on them. Like, is this really organically grown? And then we're also checking for contaminants from extraction. So if this company is using ethanol, are there any components of that left over? So the certificate of analysis, while it might look really overwhelming, it's really important. And if you get a product and you're like looking at this thinking, Angie, I have no idea how to read this, you can literally just email me, Angie at Boulder Holistic Vet, attach it on, and I will look at it for you and I can walk you through. But this is really important, and this is how you're going to empower yourself to give your pet a really safe product. And any reputable company is going to be doing this. It's not required by law, but the companies that really care and are making sure every batch is safe, they are doing this. So the next thing, and this is such a pet peeve of mine, we see so many cannabis products all over the US and really the world, but finding a product that is clearly labeled is going to help you give your pet an adequate dose. And the ingredients should be clearly labeled for you, and you should be able to read this. The concentration should be listed, and it should not contain proprietary ingredients or formulas. That just irritates me every time I see that, because maybe a client or someone in another state emails me and says, hey, I got this new CBD from whatever store or from a friend. Can you help me dose it? And I'm always happy to do that. You could always email me. I'll help you dose it. But what's irritating was when you see, well, this ingredient's proprietary. I have no idea. I can't even begin to give you or your pet an adequate dose. So when you see that, just choose something else. One thing that you will see, and this is the product I use, HempRx. Now you'll notice it says whole hemp plant oil, and it says 30 milligrams. Well, that's code for CBD, because the FDA won't let a lot of companies, or if they find out, they might fine them, they won't let them say CBD, this is how many milligrams. Now, let's say you were vetting this this product, and you wanted to know, like, what's 30 milligrams? One, you should be able to email and get that readily available. But two, you can see on their certificate of analysis that this makes sense, that they in fact have 30 milligrams of CBD. So just because a product won't say this is how many milligrams exactly of CBD doesn't mean it's a bad product. They're just trying not to get shut down by the FDA or fined. But if it says proprietary, we're not going to tell you how much is in there. I would move on to the next product.
Interesting. All right, we're getting into the math portion of this program. So we will be sending you a recording, don't forget. So if you can't take notes fast enough, no worries. You will be able to watch this again and again and again. So yeah, walk us through the steps now of actually converting and all these things, kilograms, milligrams, milliliters, go for it.
It can be so confusing, and just know that My team and I are here to help with whatever questions you have. You can always reach out to us. But I'm going to walk you through exactly how to do it. So you could pick up any product and dose your animal, because this is where you can make or break it. It's really hard to overdose your pet, and it's really easy to underdose them. And basically, if it doesn't work, it might just be because they didn't get enough CBD. So first thing we're going to want to do, if you're in the United States, we're going to convert weight to kilograms. If you're not in the United States, there's a chance that you already know your pet's weight in kilograms, but here we're just still using pounds. So let's say you have a 50-pound dog. All you need to do is divide 50 pounds by 2.2. And now you have the number of kigs. And this is important because all of these doses we use are milligrams per kilogram. And that gets really confusing. So let's get you right away into kilograms. And this could help you in really in any other area, because most things that we dose are in milligrams per kilogram. Okay, so we've got your 50-pound dog as a 22.7 kilogram. You can totally round to 23 if you want. It doesn't have to be that exact. Okay, so then we're gonna go to the second step. Now we're gonna select a dose. And this is something that you can do. Now I have a dosing chart on my website. And basically it will list out the weight in there. So there's a big chart on there that you could just look over if you didn't wanna do the math. But I really encourage you to empower yourself with this dose so that you can work up more specifically. So if you have a really sensitive animal, I would start with 0.2 mg per kg twice a daily. Non-sensitive animals, like basically when I say sensitive animal, this is the dog or cat that just reacts to everything. I mean, pharmaceutical, not pharmaceutical. I think I have a lot of those in my practice just by the nature of the medicine I do. But if you don't have a sensitive animal, definitely start with a 0.5 mg per kg of CBD twice a day. Okay, so now that we've picked out that first number, we're probably gonna, do one or the other. Let's go to the next step. Okay, so let's say you have that sensitive animal. We're gonna start at the lower dose. So this is a whisper dose. So we're gonna take 0.2 times the weight of your animal. And it's that simple. So that's how many milligrams of CBD you're gonna use. And so this is the part that's really easy. So let's say, okay, well, I'm gonna dose my dog at 4.5 milligrams of CBD twice a day. And then now we have to decide, now we have to go to your product and say, okay, well, how many drops, how many chews, how do I do this? So this is where we go to the next step. So step 4, we have to look at the concentration of CBD on the bottle. Like I said earlier, the FDA will not allow all of these companies to put CBD on the label, although I'm seeing more and more of it. For example, so this is a product I use for 50-pound dogs all the time. HempRx Forte has 1 milligram of CBD per drop, and it has 30 milligrams per milliliter. And so when you think about oil, you can always measure it out in drops, or you can measure it out in milliliters. And let's click to the next slide. So if you need 4.5 milligrams of CBD twice a daily, I would round it just to 5. And remember, it's really, really hard to overdo CBD. So if we have 1 milligram per drop, we're just gonna use 5 drops, 1, 2, 3, 4, 5. We're gonna stick it on your dog's food or your cat's food, and you're going to, usually dogs and cats will eat it. Now, if you get to a dose where it's like 30 drops, like I can't, like counting to 30, because I have 2 children and all these animals, like I feel like the attention span's never there to like actually count out 30. What I would do is if I know that there's 30 milligrams in each mil, I take 5 divided by 30, and that's about 0.2 mils twice daily. Now for 5 drops, we wouldn't need to do that. But if you had, like I said, a bigger amount of drops, feel free to stop counting and just put it into mils. And then I'm ready for the next slide. Okay, so we have, this is another strength of oil that we use. So if we have 0.5 milligram per drop, you need to get 4.5 milligrams, so you need 9 drops twice daily. And I hope that makes sense to everyone. So basically this product here is also an oil. It's just less concentrated. So you would need 0.3 mils twice daily or 9 drops twice a day. And so to get that concentration in mils, we know that there are 15 milligrams, not 30 like the other tincture. And we want to get 4.5 milligrams. You need to take 4.5 divided by 15 to get 0.3 twice a day. And I am ready for the next. And a lot of formulations, so I use the Hemp RX by RX Vitamins. They also come in chews, and each chew in this smaller chew has 1 milligram of CBD. So I'm going to give 5 chews twice a day and call it good. So these are a little bit easier to dose out. There's less math, but then there's also less, it's less flexible. So you're going to end up spending a little bit more on your CBD. And I'm ready for the next slide. One thing I want to say with syringe dosing, if you decide to use this, 1 cc is 1 milliliter. And I just clean it in between use. But sometimes people get confused because they'll go to the store and they say, well, I see a 1 cc syringe, but I don't see a 1 mil syringe. What should I do? They are the same measurement. I just feel like we needed one more measurement to be exactly the same and confusing. So it's all these MIGs, mils, kigs, cc's, but we can go to the next slide.
There you go.
Okay, so this is another thing. So I usually start with a smaller dose and then I work up. But so how quickly should you work up? And you can work up rapidly, or you can increase like 25 to 50% every 3 to 4 days. There's no hard and fast rule. And it really depends on what you're treating. For example, if your dog has anxiety, I would work up every couple days until you notice the anxiety to be at a level that you feel is acceptable. And you really want to get, especially with bigger dogs, to the minimal effective dose. And I've used doses like up to 3 mgs per kg. So like, 6 times that. But the problem with that is it's really expensive. Like if you have a 70-pound dog, and you're, giving them 40 milligrams of CBD twice a day, I mean, that's going to be hundreds and hundreds of dollars. So I usually recommend people work up slowly to the dose that works and hang out there. If you want to do more, it's not going to hurt anything. It's just going to hurt your pocketbook. And a note for cats. So if you have a cat and you don't want to do any of the math, like an average 10-pound cat, just start with 2 milligrams of CBD twice a day. Because as you can see, the math works out here. If you have a bigger cat, and let's say you're like, okay, I have just like the Garfield cat, I can't do this 10-pound cat standard. Remember to take your animal's weight, put it into kg, so you divide it by 2.2. Let's say you want to start with 0.5 mg per kg, so you take 0.5 milligrams times 7, and that's 3.5 milligrams. So I'd probably do around 4 milligrams twice a day. I think it's really important that we dose our animals twice a day whenever possible. We do have enough studies to show how CBD, how long it lasts in the blood. And it's also important to give it with food when possible, because we think it absorbs better with a meal.
So we are at the question and answer portion of our program already. Is there anything else you wanted to add before we jump into Q&A?
I don't think so. That was a ton of information.
That was a lot.
Stuff to get everyone started.
Yeah, very good information and very practical. But I did have one question that came up for me just a slide or two ago. By the way, you might be hearing some dogs barking in the background. I have 2 small dogs inside, 2 large dogs outside, and occasionally the gerbil will start going on her little wheels. So if you hear sound effects, I think it's very apropos for this webinar. Let me ask this one question that that just kind of came to me as you were talking about dosing, and we were talking about starting slower, going slowly, or you could go rapidly. What are some signs that the CBD may be having some adverse effects? Like where do you get to? I know like with humans, they say if you have too much, it's not like it's going to be very harmful, but it can give you stomach cramps, you might get diarrhea. For pets, how would you know if you've kind of overdone it?
Yes, I mean, diarrhea can happen. I see that more commonly in cats. And I think with dogs, they just get too relaxed. I think a lot of pet parents just notice like, hey, like my dog didn't want to do anything today. And that's never going to be the Jack Russell. It'd be really hard to get that Jack Russell or the Border Collie too relaxed. But what I find is like, I know,
Like,
it's not going to
she's
work.
Crazy.
Yeah. Like at best, you're going to just take the edge off. But it's usually the older lab that's kind of just really chill, that you just notice like, I think we're a little too sedate. But other than that, it's usually just the GI signs. And I usually see that with cats.
I have also a different question too. You had mentioned about cancer, and I wasn't sure if one of the dosing slides was specifically for cancer, but could you really address that when your dog or your cat does have cancer? And is it specific kinds of cancer or all cancers? What kinds of dosing are you looking at?
Yes, so I use it for all kinds of cancers. There's enough evidence, at least for people and other animal models, that CBD does have anti-cancer effects, and it's really supportive to promote appetite and just overall well-being. And I usually start with a 0.5 mg per kg, but I work up rapidly. And I'll sometimes work up closer to like 2 mgs per kg, depending on if we're dealing with pain or I need a lot of appetite stimulation. But for prevention, I usually recommend starting out with like 0.2 mgs per kg. If you can afford to keep your dog at that 0.5 mg per kg for life, that's great. But if you have a 100-pound dog, that can be really expensive. But some is better than none.
So Denise is asking, what about if you want to prevent cancer? I was just reading her question. I'm not sure if you just finished answering that, but what would be the dosage if you wanted to prevent cancer?
I would start at least at 0.2 mg per kg twice a day, so that lower dose. And then if you can afford to keep your dog or cat on a 0.5 mg per kg twice a day all the time, I think that's my favorite.
So for a dog that is, I'm more of a dog person, so I don't know a whole lot about cats. For a dog that is really aggressive, are oils going to be better? Are chews going to be better? I actually have recently seen an oral spray of CBD specifically for pets. Which would you, especially for an aggressive dog, that might be a little bit harder to even administer that. We had a rescue, by the way. I mean, this is when I was thinking of aggression too, because obviously we wouldn't keep an aggressive dog, but we rescued a dog that had been chained up and starved right in our neighborhood, and we rescued him. And for the first year, he was anxious and aggressive if you went to his food, very protective and very stressed. I wish I had known about CBD back then. But what's the difference for an aggressive dog versus just an anxious dog?
Yes. So aggression is different than anxious. So for my truly aggressive patients that maybe have like a bite history, or it's so severe that maybe they're not safe around people, usually CBD alone is not going to be enough. I usually have it on board, but usually there's other behavior meds like Prozac or Clonidine. There's other things that we do to keep that dog and the people around them safe. But as far as administration, I think oil is my favorite. I think we know that it's absorbed really well. And then as far as the sprays, I would be interested to see how that works out. Most cats are not going to like that. It'd be interesting to see how dogs, like how they experience a spray in their mouth. It makes sense because that mucosal absorption is quite good. But right for now, I definitely use on food, or people put drops in the mouth. Just depends on what your dog will allow.
And they're making flavors now that are more appealing to pets, as opposed to the peppermints that humans seem to gravitate toward. I also have a chocolate mint for myself, not for my pet, flavored oil tincture, CBD tincture, which is absolutely delicious. But yeah, the flavors. We've got some more questions here. Do you recommend including THC with the CBD products for dogs?
I don't recommend THC for dogs. I wouldn't use anything that we know has more than 0.3% of THC, just because I think it makes them anxious and it's hard for them to report how they're feeling.
So someone else is asking, are you familiar with the benefits of CBDA for pets? So that would be the acid form of CBD.
You know, I haven't used a preparation with just CBDA. I've only used THCA, or I've had many of my patients using THCA, which is a non-psychoactive form of THC. And so I can't speak to just the CBDA.
I'm wondering though about THCA, because that is the pre-decarboxylating. So it's not been heated. It's the acid form, the early form, the raw form in CBD. So that shouldn't be a problem. Am I correct?
It shouldn't be a problem. I always wonder how those are handled. There's a lot of THCA hanging around Boulder County for sure. So I see it a lot, but I always wonder what it would take being left out in the sun, or what it might take to convert that THC.
And into the psychoactive, psychotropic version. Yeah, that's a good point. Heat. I wonder about that.
Yeah, I don't know how stable it is, but I think in theory, it's a great idea.
Yeah.
Yeah.
So, dogs and cats, you exclusively treat dogs and cats? Or, okay. Because I heard that, so birds may have endocannabinoid system?
They do.
What other animals that might be pets?
I mean, I think all the pocket pets like guinea pigs and gerbils, hamsters,
rodents.
Yeah. Ferrets, horses. There's a lot of CBD use in horses now. Yes, absolutely.
Yeah, that's true. That's true. I
bet you have to give them big doses, though.
Big doses. Like the horse chew would have to be like this big.
I know.
Highly concentrated.
I have 2 horses, and I'm giving them just big doses, and they actually do well on it.
Do they
really?
Well,
how are you administering it, or how much are you giving them?
I'm giving them like 20 to 25 milligrams a day.
And you're doing it oil into their mouth directly?
I put it on their food.
You put it on their food. Well, that's another thing wondering about, because oil put into the mouth, if they'll keep it in their mouth, whatever the animal is. Yeah, like you said, the mucous membranes, mucosal, how do you say that word? Mucosa?
Yeah, like that mucosal absorption or the mucous membrane.
Yeah. That would be a really good way of getting into their bloodstream quickly. But when you put it on food, that's going to pretty much bypass a lot of that, go straight into the digestive system, come out from their liver. And I know for humans, we're told that these days, thinking in terms of indica and sativa, if you're doing an edible, it comes out of your liver in a different form, a more potent form as well. So yeah, I'm just wondering about that. When you put it on their food and they're digesting it, then it comes out their liver. It seems like it would be a little bit different. So
yes, it will experience that, what we call first pass metabolism.
Metabolism, right?
That is what the tricky part is I, if I could ask my patients, like, I'm going to put these drops under your tongue. Now just hold it. Just hold.
Tell us how you feel. Tell us how you feel too. Yeah, switch it around.
Swish it around.
That's true. Yeah, exactly.
Yeah. But some people do put it in their dog's mouth, and if they hold it, that's fantastic.
Yeah. So another question is, which is more effective, the chewable products or the oil?
I find them to be equally effective. I prefer the oil because it's more cost effective and I can get more milligrams per bottle. It's like with the chews, you're paying for that, all that extra material, the extrusion process, because it's a cold extrusion. So it's a little bit more expensive. And then for those really sensitive animals, then you're adding all those other ingredients to their diet. Yeah.
So we have another question here too.
Oh yeah, good, thank you.
Yeah. So for topical, so actually putting the CBD oil on the skin, is that more effective, or should we be dosing internally? So like for dermal problems, as well as eye issues, tumors in the eye, so on and so forth, is it more effective to dose internally or put it on topically?
I usually do both. We don't have a lot of pharmacokinetic studies to know how we can get all those endocannabinoids through the skin. But I suspect that we will have those. And I think in cats, there's going to be maybe some preparations where we can stick it right on their ear. There are other medications that we use because it's bald right there. Dogs are trickier. And I do think that there is a future for topical preparations. And I always tell people, like, anything you put topically on your cat will end up in the cat eventually.
Licking and licking.
Yes, yes. So it's going to make it in there. But I do, use it topically, but then I also use it systemically. I was like, I would want it both places.
So even for like an ear infection, or even to keep their ears clean, like some breeds are more what's the word I want? Have like, more ear infections, right? Yeah. So could we do that proactively?
Absolutely. I actually have a couple patients in my practice now that have chronic ear infections. Now, we haven't gotten them to go away, but the inflammation in the ear is way less with topical CBD use every day.
That's amazing.
Yeah. Isn't that great?
So you can actually use just the regular oil that you would otherwise ingest. You could use that and rub it on.
Yep. Just stick a few drops in the
ears.
Yep.
Oh, that's a good idea, because one of my dogs is getting a lot of sort of infections, crusty and kind of blackish, almost like scabby. So I might give that a try. That sounds great. And one last question, and then we're just going to wrap everything up. This has been very enlightening. Thank you so much. As a pet owner, pet lover, with dogs. and gerbil, can't forget the gerbil. I've actually learned a lot of things right now, and I'm thinking I'm going to go try putting some of the drops that I have into one of my dog's ears, and I'll let you know what happens. But we do have another question, and I think this is something we have talked about, but we'll give her the answer directly. So, do you recommend using CBD daily, or only as needed for a pet that is generally healthy?
I would use it daily. Yeah. The more I use it, the more I love it. CBD for everybody.
CBD for all. For all living things.
You get CBD. All my animals are on it. Everyone.
Excellent. I'm going to bring the slides back, but we don't have to shut off our video right now. I just wanted to go through a little bit more information. I'm really excited, everybody, to have you here. And for those of you who are going to be watching this afterwards, hello. Reminding you all, you are going to get this video. And if you want to join Ellementa, be part of what we do, you can be part of our online groups, ellementa.com/groups. They're on Facebook, but a lot of people are, but they're closed groups. So we don't let everybody in. So you would have to ask for an invitation. Gatherings, ellementa.com/gatherings. That's where you'll find out about our events. And we're on Instagram, Facebook, Twitter, and Pinterest. All right, we're a little guilty of not using Pinterest as often, but we are there. So if you're there, please say hi. And Dr. Angie, do you want to let them know where you're available?
Yes. So you can go to our website at boulderholisticvet.com. You can also email me if you run into trouble, if you have any questions, at Angie@boulderholisticvet.com. You can find us on Instagram and Facebook. And if you would like more information, you can sign up for our Cannabis Quick Start Guide. And I think that you will also receive this link in an follow-up email. Yep.
Yes, you will. So everybody who is watching now and those people who have registered, you will all receive an email, and it will have everything spelled out for you. So it'll be very easy to click on as opposed to having it on the screen at the moment. I wanted to just let everybody know that our next webinar is November 13th. By the way, I'm dyslexic and I apologize with numbers. It's November 13th. It's Wednesday, November 13th. True Potency at truepotency.com. They are curating CBD products and doing their own testing actually getting a third party to do additional testing on the products and make sure they have what's in them. So we're going to be talking to a neuroscientist from True Potency. And again, November 13th, just go to elementa.com/webinars and you'll have a link directly to register for that. This has been so good. This has been a lot of fun as well. I had the best time picking dog and cat photos for this. Thank you, Dr. Angie, so much for imparting your wisdom and sharing that with all of us here and everyone who will be watching this again and again. Thank you, Erica, for your absolute magic. I can't do these things without you. When I do have to do them without you, I'm like, where's Erica? Where's Erica? Thanks for those who were here with us live. Hello, everybody watching on Facebook Live. And we can't wait to see you again and bring the experts right to you. Thanks, everybody.
Thanks.
Thank you. See you later.
Take care. Have a good evening.
Thanks so much, Dr. Angie.
Yeah, you're welcome. Thank you. Happy to be here.